Hey, I want to talk about, I think, probably one of the most important subjects that I've ever discussed on a video, and it's for you guys out there who have had back or neck surgery. Um, there's a common thought that after you have surgery, a lot of times people have a little bit of rehab. They'll go to therapy, they'll do some stretches, maybe get some heat or ice and electrical stimulation or what have you, and there's this idea that kind of after that phase that you're at your peak. The surgeon gets in there, and I believe typically they get in there, they take the pressure off the nerve, they remove some of the disc, or sometimes they have to put hardware into the spine to hold it in place. And that after a month or two of rehab, that's it. And you know what? The truth is, most of the time after a surgery, people still have remaining pain. And maybe a lot of times it's much better depending on the condition, but they've got limited motion. And over time, especially in cases where there was a laminectomy or a fusion done, there's a breakdown of the segments above and below the fusion. Now, where does chiropractic play a role? I got to tell you this, it actually can play a huge role. Just this past week, we had a patient who had a cervical fusion. So it was between, I think, 4 and 5 and 6. So several segments were fused together. It was from a past injury where she had paralysis in the arm. And so the surgery was absolutely necessary, absolutely helped her out a ton. But ever since that initial accident and then on, there hasn't been a whole lot of treatment in this area. And again, a lot of times it's out of fear. And of course, you know what? Yes, I think in a long time ago, chiropractors were aggressive with people and did everything available to get that magical crack or pop. Chiropractic's not like that necessarily anymore. What my job is, and I tell this to people all the time, it's about finding out which joints aren't moving and putting motion into the system. And it doesn't not, like with this patient the other day, she's had right-sided neck pain for years. It hurts to bend her head backwards, to bend it to that right side, to turn it to the right side. And you know what I did? So this is the segments that were fused. I adjusted down below in the mid-back. I just mobilized these segments above the fusion and below. And I did a little work on this area where the scar is. So there's no cracking and popping anywhere near the fusion where we could do any harm whatsoever. But it's a gentle, literally, it's my hands moving at this type of speed just to stretch things out above and below that area. And then some work on the soft tissues. She sat up off the table, was able to turn her head further than she had in years, was able to bend back further than she could in years, all with less pain. So the point being with this is if you've had a surgery, even a fusion, and you're thinking to yourself, it's never gonna get better, you know what? Give us a call, please. I would love to see you. We can do an exam. We can take x-rays. I can tell you if we can help you out. And again, don't be afraid. This is not old school chiropractic where you've got to get cracked or popped. There's a lot of other methods at our disposal. So I hope this video helps you out. And if you've had a surgery in the past, or a family member or a loved one or a friend has, and they're still suffering with pain, absolutely does not hurt to at least get it checked out and see if we can take you to a different level and get your life back. So I hope you found this video helpful. Have a wonderful day. Bye-bye.